Skip, could you start off by just introducing yourself?
Yes. My name is Skip Bangley. Respiratory therapist. I've been a respiratory therapist since 1976. Been in leadership in respiratory care since 1980. Have been here at Vidant Medical Center in Greenville, North Carolina since 2007. And I I just love respiratory therapy and have a fairly large department now. We're a 1,000 bed medical center here, and have eight other hospitals that are part of our system.
Great. Now, you've been a partner with the Faces Foundation and the Phil Ward since 2015, I understand. So, could you give us a little bit of an understanding of what the Faces Foundation and the Phil Ward are?
So the Phil Award and the foundation. The foundation is a non-for-profit organization that is really centered on respiratory education and clinical performance of the patient, taking care of the patients, taking care of the family, being compassionate. The way we are using it here is to use it with compassion more than clinical excellence, as far as the actual care of the patient and the knowledge base that the respiratory therapist has. We're really using it for the compassionate part of our care. Where's our heart? And that is in a nutshell what I believe the foundation and the Phil Award itself is focused on.
So, you have been a partner since 2015. Can you take me back to when you initially signed up as a partner, and what really motivated you to sign up as a partner for the Faces Foundation?
Yes, I became involved with the foundation. I think it was really many years, but 3 years before that. So I've been around 2012. Shaman came to our North Carolina Society Respiratory Therapy meeting and did a presentation to our society on the award itself. I fell in love with the story of what how she founded this on the honor of and memorial of her husband, and the meaning that she presented for the compassionate care of the patient. It took me a little while. I ended up seeing her again at the AARC Congress. She came to the managers section meeting and presented there, and that's when I really pulled her to the side and started talking to her. And I think we had a cup of coffee, and then I was sold after that. And that's when we really started here.
Talked a little bit about it being a compassion award within your actual hospital system. How do you actually operationalize it within your hospital system? Specifically, the awards. How does that go on a yearly basis? Is there one award or are there multiple awards? How do you implement that within your organization?
Right. The way we implement it here, and actually it starts off with a little brochure that we actually developed, that we hand out to the patients. We have them in the patient care areas. All of the nursing stations have a waiting area, and we put them in the waiting areas of the patients' visitation rooms. With COVID, it's been a little bit of a problem, but basically that has been where we get a lot of our nominations is from family members that were touched by one of the respiratory therapists. We also make sure that if I get a note from one of the floor nurses or a physician about a therapist that did something way over what would be expected, I give them one of the nomination forms and ask them to send it to me. All the forms come to me as the manager, and then we collect them through the year. And then my leadership team, my shift supervisors, and myself and my assistant manager go over all of them. I block them out so nobody knows who the individual is but me. Um, and they just read the story and they give me a vote on who they think is the top. And then we take the most votes for the top. So there, it's really blinded except by me on that. And we do the same thing out in the regional hospitals. We give one here every year at the medical center, and we give one to our divided up among our eight regional hospitals. They're smaller, and so they have a smaller staff. I usually it works out fine because I may have one or two representatives from each one of the eight hospitals, and then the regional managers also do that as well.
Got it. What about your continuation of working with the foundation? You've been with the foundation for several years. Obviously, there's a certain level of effort that's required to continue to participate in the program. What keeps you motivated to remain a partner with the Faces Foundation?
The main motivation is the faces of the staff that's getting it, um, and the the meaning that is developed. The nursing departments have the Daisy Award, and I happen to report up through a nursing department. So my administrative lead is actually a nurse that's in charge of all the critical care units in the hospital and several other services. And she participates in the Daisy Award. So when I explained to her what the Phil Award was when we went under them, it was pretty appropriate. I think it's appropriate for her to be part of that process, and she's jumped right into it. She's a very compassionate person herself. So I think it's given more recognition to respiratory therapy through the nursing department here, which is huge. To the physicians because I get nominations from them as well. Um, they understand what the award is about, especially my pulmonary critical care physicians. Um, and to the other departments because we put it out on our electronic newsletter here at the hospital and through Vidant Health for the regional hospitals as well.
Got it. Now, you're talking about working up through the nursing department. A question that comes to mind is they obviously have the Daisy Award. Most of the departments around the country do. So, was it an easy sell to them when you said that you wanted to bring in the Phil Award working with the Faces Foundation? I would assume they got it intuitively.
It was really I think it did help us ease it because there's always a little bit of a discussion within most hospitals that I've worked in, and I've managed several, that there's a some hard feelings sometimes between nursing and respiratory therapy or nursing and other departments because a lot of attention is given to nursing and there's little attention given to the other departments because nursing is so big. It's not a negative thing. It's just they're the much bigger department. Um, this kind of evens the table a little bit and that we have a national award that we can utilize as well, and I think it adds a lot of credence to it.
I know you're a big proponent of the Faces Foundation and the Phil Award specifically. What's the perception amongst the larger respiratory department, both at the medical center and then and the other campuses?
It's not a competition, and that's one of the things we've tried to sell everybody. It's not a popularity contest. So what's impressed me is early in, I had some staff that were trying to approach it as a popularity contest, and I made it clear that it was going to be the true story that just going to lead us to the winner of who's going to get the award. And over the years now, we've proven that there's been some new hires that have earned it because what they did was so amazing. There's been some people who've been here for 15 to 20 years that have earned it. There've been people who work the intensive care units, and there's people that work only the floors that have earned it. So I think we've proven that it's not who you are, is what where your heart is, and what have you done.
Now, I know over the past 6 to 7 years that you've probably been presented with a number of great stories. Is there any specific nomination story that comes to mind?
I think the one this year it brought tears to a lot of people. There's a gentleman that he's actually had only been out of school a year, but during that year he was. I had several emails from physicians and from nurses about things that he was doing, going down to the coffee shop to get somebody something. And we're busy, a really busy department, but he was taking time to do that. He found a family member that their shoes that when they came, we get people from 2 hours away here because we're a referral hospital, and they showed up and their shoes had been all torn up. And he went to Walmart when he got off duty and brought the person some shoes. Um, but the thing that got him the award, that those things built up to it. But the thing that got him the award was during COVID, he volunteered to work the COVID unit, the intensive care unit, and we had a couple in our intensive care unit in the 80s. The wife was actively dying on the ventilator. She was still awake, but she was actively dying. The husband was on non-invasive mass ventilation. He wasn't really great, and it was looked like he was heading towards intubation. The wife made a comment to the nurse that she really would just like to see her husband one more time and she could pass in peace. And that nurse made a comment to this therapist. The therapist took it upon himself to go to the physician and say, "Listen, I will make sure this man is safe. Can we get him down to where he can at least touch his wife's hand?" They both have COVID, so and it was an isolated lockdown unit. And he made arrangements to get a portable machine that we can utilize for non-invasive mass ventilation. He stayed with the patient, got the patient down there, rolled, helped the nurse roll him down there, stayed in the room with the patient, and the husband was able to hold the wife's hand. She passed away an hour later, and he ended up going on a ventilator, and he passed away about 2 weeks later. But that nurse that was part of that sent me the nomination and gave me those details on what took place. And so that's the compassion that we're talking about here. That is the heart. I can teach clinical, I can teach the knowledge base, I can teach the skills. I can't teach the heart. And that's what this award allows me to acknowledge.
That's an amazing story. I'm trying to keep it together myself.
It was tough giving that one out. And well, you were going to ask me about how we do the awards. I will go ahead and get into that. Is what we do is we invite the family of the person that's getting the award. So and we don't let the person know. It's a surprise to the person that they're going to get the award. Um, and we invite their family to come in. Well, this gentleman's family came in. We made arrangements for them to come in, even though this was on. We were still in COVID time. I had it cleared with my administration to be able to do that, and they all were masked up and everything. But um, his wife and his parents and her parents and a brother came to see him get the award. And there wasn't a tear. There wasn't a clear eye in the crowd by the time I finished reading that story. And his wife really didn't know that had taken place, but she wasn't surprised because she knew her husband, and what kind of compassion he had.
No, that sounds like a special ceremony, bringing the family members there. Is that, I know non-COVID times, is that how you typically give the award with family members present, or how does the ceremony look like typically in your institution?
And during non-COVID, we try to get, if it's a family member, patient's family member that makes the nomination, we try to have their family member, or members of the patient's family actually come. They're invited to come to the ceremony as well. And I usually have them actually give an explanation of why they nominated the person, if they're comfortable with it. If not, I'll read what they submitted. Um, in this case, it was we didn't invite the family of the patient, but we invited his family. Now we always try to invite the family of the person receiving the award too, to make it more of a family type thing. We always say our department is a family, and it kind of helps expand that whole definition of what a family is.
That sounds wonderful. Now, I just heard at the beginning, um, before we started this interview, that last year that your staff surprised you with the Phil Award. Could you speak a little bit to that?
Yeah, my my leadership team, I believe this actually started with my immediate supervisor, my immediate administrator, and that's the nurse that's in charge of all the intensive care units. She's a vice president here at the organization, and um, started asking my assistant manager questions about how do we nominate the Phil Award. And my assistant manager said, "Well, we only have subscription for one here at VMC. We do the other one in the regional, and Skip's going to want to make sure that we do the regional and we do the one here with the staff." So she made arrangements to go ahead and order another subscription for one, unbeknownst to me, because she did it on her expense account. So I didn't see it. And they invited my wife, and they did it the day that I was giving the presentation to that other gentleman that I just talked about. So I was already kind of an emotional challenge a little bit anyway, because I knew I was getting ready to tell the story that I just told you. And then out of the blue, my wife shows up in the staff room, and I looked at her and I go, "Okay, are you lost? Why are you here?" Because she doesn't work here. And then all of a sudden it hit me, and I looked at Patty, my senior, my vice president, and I just said, you got me on this one." And so it was heartwarming for me as well. It really was, and totally surprised me.
Sounds like you've been a big advocate for this, so it was a special moment for you, as
Mhm.
you've articulated, and well deserved. Now, we also discussed at the beginning here that the Faces Foundation and Field Awards still is not well recognized amongst the entire country. There are still many hospitals and systems that are unaware of this. And so I wanted to ask, for someone who has been a part of this organization over the past 6, 7 years, what would you say to those people that have never heard of the Faces Foundation or have heard of it before but really haven't engaged?
I would say start asking questions. Start finding out. There's a list of facilities that are utilizing this award now. They can call me. I'll be glad to talk to them about what we do with it here and what it's meant to my team. Um, we Getting it out to the state societies, and that's how I first heard about it, and having some time for people to ask questions about it. But I really, for the people that haven't heard, it's hard to figure out how we're going to get the word out to them, other than by word of mouth. I have shared it with several managers, and I've been fairly active all through my years in different regions of the country, and so I do have some contacts that I have mentioned it to, and I think a couple of them have actually been able to secure it. They're utilizing it in their facilities now, I believe, and I'm not sure, but um, I I just think everybody that's using it now just needs to let people know what it means to their department.
And what about those people who say, well, our respiratory department already has ways of recognizing our respiratory therapist. Why should they consider the Faces Foundation the Phil Award if they already have awards in place?
Well, I would say the first thing, and the reason why I mentioned that it was not a popularity contest is because internal processes, we tried one here, the Therapist of the Year award, and that became a popularity contest. I would get nominations across on somebody that I was probably getting ready to do some corrective action on, and they wanted to make them the Therapist of the Year. With this, we made it clear this is not who's the favorite person in the department. It's who's doing the best compassionate care that is has stories that are coming their way that they don't even know about. Most of these therapists don't even know these stories are coming to me.
Great. No, thanks for that explanation. And just end the interview, I just wanted to give you an opportunity. Is there anything else that you'd like to say to those people listening in that hasn't been covered thus far?
I guess to end it, I would just say that if you don't know about the Phil Award, pick up the phone. You can call me at Vidant Medical Center in Greenville, North Carolina. You can look online on the Faces Foundation. They have all the information right there. It is to me as a manager that's been doing management since 1980. It's a no-brainer. This is not a very expensive program to run. It's well organized. It's very responsive. The turnaround for the awards and the information that comes with those awards and the sculpture. It is a big deal to those therapists that are getting it, and it's a big deal to the therapists that are sitting there watching, because I have seen it open up the doors to some of the therapists that was sitting on the fence, and then all of a sudden you start seeing them finding people that they can help and doing things not to get the award, but it's because they were moved by that award ceremony. They were moved by that person. And it helps, I think, with the teamwork within the department because they have more of an appreciation of the heart within the department.
Excellent. Well, thank you so much for your time. I really appreciate it. And thank you for really impactful and emotional stories.
Okay. Thank you very much.